Good morning, everyone. This is Abdurrahman Ali. I'm a Cardio-Oncology Fellow at UTMB Galveston. I'm happy to be here this year at the Global Cardio-Oncology Society at University of Minnesota, Masonic Cancer Center. I have the pleasure today of having Dr. Blaes with me. She is the Professor of Hematology and Oncology at the University of Minnesota Masonic Cancer Center. She's the Director of SPECS Program for Cancer Screening and Prevention. And she is the PG Chair of Oncology, PG Kennedy Chair of Oncology at the University of Minnesota. And most importantly, she's our host for this year. Good morning, Dr. Blaes.
Good morning. Thank you for having me.
And thank you so much for your time. So we'll start with asking about what are the main key goals for the conference for this year?
Yeah, thanks for having us here. We're really excited to have and host everyone here in Minneapolis this year. I think our goal is really to bring cardiology and oncology together. We are co-hosted by the Masonic Cancer Center, so the first time that GCOS is being hosted by a cancer center in collaboration with a cardiovascular center, the Lilly-High Heart Institute. But really, as you know, the whole goal is to talk about how to advance the science, the research, and the clinical care. So this year's conference is really focused on highlighting a lot of that between a research symposium and a nurses symposium, followed by 2 days of a clinical symposium where we'll talk about reverse cardio-oncology, what we know about the underlying diseases between cardiovascular disease and cancer. We'll talk about the changes in clinical care, particularly with the advancements in hematologic malignancies, CAR T-cell therapy, and really then sort of dovetail into atherosclerosis as well as thinking about survivorship. One of the largest populations of cancer individuals affected by cancer right now are those who have been living for a long time or are living with their disease as well. So thinking about how do we care for our survivors. And I think finally what I'm really excited about is we have a whole session really also talking about the advancements in artificial intelligence and technology in cancer care and cardiovascular care, and how that can advance us on the clinical side, but also on the research side in advancing the science.
That's terrific. And just to highlight to everyone, first day will be a research symposium, nursing symposium, and following by 2 days of clinical session. We talked about the important, or the hot topics. What would you like your attendees this year from the event to take away from this conference?
I think for the cardiologists, I think that what will be unique for them is really thinking about cardio-oncology and what we know about the underlying pathophysiology of the diseases between what we understand with reverse cardio-oncology and atherosclerosis. I think they'll also have a unique opportunity to interact with hematologists and oncologists from around the country and the globe, really understanding how the practice has changed. And this includes in technology such as radiation, where there are certain patients, for example, in breast cancer, where we're no longer doing radiation. For the oncologists in the group, they focus very broadly on cancer care. And so for them, this is a very unique opportunity to really think about the heart during treatment and after treatment, and how do we keep patients healthy during their cancer care.
Sounds good. And also we would like to highlight that we just, similar to last, we have an entire session for posters, and there will be a competition among different applicants for this year's event. Is there anything else we would like to highlight?
I would just say that there'll be some of the meeting materials and recordings will be available after the meeting as well, but we're really excited to have people here in person in Minneapolis.
Okay, we're excited to see it here as well. I would like to ask you guys to follow us on Twitter and other social media platforms. We'll be posting some interviews during the conference for the next 3 days. Thank you so much for your time, and hopefully you guys stay tuned.